When we were working in the field, when COVID first started, we noticed there was a lot of gaps. The seniors weren't getting the care that they needed and they were scared. People are getting lost in the system. Community Paramedicine is helping fill those gaps.
We're really bringing everything to them in one package so they can just address small issues early on before they become big issues later on that put them in a hospital or into a long-term care facility.
Instead of doing the emergency calls, we're trying to prevent emergencies now. So we're going to people's houses, collaborating with primary care, and kind of bridging the gap in between them.
Non-urgent medical care in the home. It's going to help the system as a whole.
It is alleviating the stress on the emergency rooms right now.
I feel with the age demographic that we're dealing with, they can be overwhelmed. We get to help them out. We reduce their stress.
They feel more independent. They're allowed to be in their home and be in their comfort.
We look forward to their visits. You're not waiting for a doctor's appointment to ask a question that they can answer for you.
Instead of going 2-3 months without seeing a doctor, nurse practitioner, well, this is a security for me when they come. I think that was the best thing ever happened.
There's so many gaps in healthcare right now, and we just want to tighten the gaps.
So many people have fallen through the cracks and they haven't had anybody advocating for them, and we really advocate for the patients.
Community paramedics are not just strictly dealing with the health of somebody, they're dealing with all the social insecurities also.
No senior should be going without food. No senior should be worried about their finances, unable to make a doctor's appointment. So I feel when I'm able to do those types of tasks for seniors that I'm making a difference.
The best part is they come and they see you, they talk with you. You have, a connection that otherwise you wouldn't have.
For 20 years, I worked as the road medic. We put them through the doors of the ER and the doors close and there's never any follow-up and you never hear anything about what happened to them. With Community Paramedicine, I've been able to form relationships with our clients and learn about their lives and learn about their medical conditions and how they got to where they are now.
It is just so amazing, the service. We have been, talking with friends and explained it, and we want to sign up. It is a #1 service.
I feel very proud of the work we're doing, the difference we're making in people's lives.
It's been a pretty impressive thing to witness.
Seeing people progress, you start to see the difference that you're making. You see people involved in their own health care far more than they were before.
Hearing from the patients themselves when they've said that we've made a difference for them, that we've brightened their day, that we've accessed something that they didn't have access to before.
I feel like even in just a short time, we've prevented heart attacks, strokes.
Having somebody come into the home to visit with them makes the seniors feel that they are important and that they matter.
I like them coming in and out. I really do.
These people really needed us. They needed the support. They needed the help. They were getting lost in the system. This is perfect. This is what we need. This is what's going to help bridge that gap between the emergency room and the clinics, and they're not going to get lost. This is an amazing program.